How universal is universal healthcare? Well, on today's episode of the Wealthy Podcast, we get into just that. My guest is Dr. Ross Hickey, who is an economist at UBC Okanagan, who specializes in public policy, the economics of charitable giving, and the system itself. He and I have a very insightful, spirited conversation about the system of healthcare in Canada, what universal healthcare entails, what it covers, what it doesn't, and maybe some opportunities for all of us to be more engaged and have more agency in the healthcare that we are receiving in this country. You're going to want to listen up. Today's conversation is a little different, but absolutely connects to everything we talk about on the Wealthy Podcast. We often explore health and healthcare through the lens of personal experience, our bodies, our families, our care teams. But behind every hospital visit, every innovation, every breakthrough, there is a system. We refer to it often simply as the system, a parking lot for all aspects in healthcare that mostly feel outside of our control. But today, the system is the topic. Recently, the KGH Foundation hosted a forum for our legacy donors focused on the economics of healthcare, how it's funded, how it's structured, and how Canada compares to other countries around the world, and even more specifically, how charitable giving impacts healthcare in Canada and the tax implications around it. Our guest today, Dr. Ross Hickey, helped guide that conversation. Dr. Hickey is an economist at UBC Okanagan whose research focuses on public policy, the economics of charitable giving, and how governments make decisions about resource allocation. In other words, how we decide what gets funded, what doesn't, and why. So today we're going to zoom out. We'll explore what makes Canada's system unique, where it's strong, where it's strained, and what global models can teach us about sustainability, equity, and innovation. Because if we want to understand healthcare and more broadly, the role of philanthropy in our healthcare system right here in the Okanagan, then we need to understand the incentives, trade-offs, and economic realities underneath it. Ross, welcome to the Wealthy Podcast.
Thank you.
It's great to have you. So I always like to start with, the classic, who are you and how did you get here? What sparked your interest in economics? And more specifically, how on earth did you come to specialize in the aspects of tax implications and charitable giving and all of those sort of nuanced areas of specialty that you focus your research on?
Okay, well, I'll try to make it brief.
Yeah,
if I
tell
can.
me about little Ross.
Yeah, so
counting
little Ross,
the pennies.
yeah, little Ross grew up in Newfoundland, and I did
Okay.
have an early interest in things related to economics. I would get in trouble for lending money to my siblings and charging high interest rates, that kind of a thing. But I think specifically what encouraged me to study economics was that I grew up in Newfoundland in the time when we had the cod moratorium. So that was Newfoundland's major
Cod like the fish.
Cod like the fish, yeah. So fishing was the major industry, and then they put a moratorium and prohibited all fishing of codfish, which was the major stock that was driving the economy in 1989. And there was huge unemployment, so like 20% unemployment rate when I was around like 9 years old. And so I saw that impacting people I went to school with in particular. Like my parents were teachers, so we weren't directly affected, but I saw a lot of friends, they would have parents having to work abroad, like working in Alberta. That was the start of a lot of the migration from Newfoundland to like northern Alberta to work in the oil fields and things like that. And so I just took an interest of like, why, what happened to your dad? Where's your, what happened to your mom? Where are your parents? Why are you spending so much time with the extended family? And so I started thinking, well, it's really complicated, right?
Mm-hmm.
It's really not clear why the economy can affect people's lives at such a deep individual level. And so when I got to university, I first thought, I want to study resource management. And like, how do we get into this situation where they had to shut down a fishery? It must have been mismanagement. And then when I started studying, I'm like, well, actually, that wasn't that interesting. So like there was some mismanagement, but it's political, right? Like a big part of what happened there was that politics dictated how they were deciding how much fish they would let people catch every year,
Mm-hmm.
to the point that they just drove down the stock. And so that once I saw like, well, politics is more of what's going on there, I thought to myself, well, I'm more interested in the economics of things. And I decided to major in economics. And yeah, from there, I had lots of professors that kind of inspired me and encouraged me in particular to continue to study in economics. I wanted to just go get a degree and then get a job. And I had some professors that said, well, you like this, you should go to graduate school.
Mm-hmm.
And so then I found myself, I did my undergraduate degree in Nova Scotia at St. Francis Xavier, and some professors there encouraged me to go to graduate school. And one of them went to Simon Fraser University in Burnaby.
Yep.
And I thought, well, I like this professor a lot. I'll just go where he went. And so I went to SFU to do a master's degree, and then again thinking like, oh, I'll do this master's degree and then I'll get a job somewhere in Ottawa. I actually had a former professor who was going to work for Department of Fisheries and Oceans in Ottawa, and he said, when you finish your master's degree, you can come and get a job in Ottawa. I thought, oh, great. So I was doing my master's degree, and then as that was going, I had a professor that said, what are you doing afterwards? And I said, oh, I'm going to go to Ottawa and work for the government. And he said, are you sure you want to do that? And I said, I think so. And he said, why don't you, I told him about the professor offering me this job, and he said, why don't you call and ask what you're going to do in that job? And I did. And my former professor explained what I would do for Department of Fisheries and Oceans. It just sounded boring, to be honest. And then I went back to the professor that I was talking to at SFU and said, this is what he said I would do. And the professor said, why don't you stay and do a PhD? And I said, okay. I just thought, yeah, I'll stay and do a PhD. And so that kind of, that was a big change for me in terms of like deciding what I was going to do. And I thought to myself, I don't know if I want to do a PhD. It seems like a big commitment. But then that professor, his name was Christoph, he said, you can always quit anytime you want and go get a job. You can always go and work whenever you want. And so that's what I thought when I went into it, but I haven't looked back. I just kind of got interested in research. My research throughout my PhD was looking at an area called fiscal federalism. That's where we live in a federation in Canada. There are multiple levels of government. There's a municipal, provincial, federal. They each have different responsibilities in terms of providing public goods and services. They each have different instruments they can use to raise revenue, like property tax at the municipal level and income taxes at the federal and provincial. And so I studied that throughout my PhD studies. And then afterwards, when I finished, I moved here to Kelowna. I got a job at University of British Columbia, Okanagan, as a professor. 2 weeks after moving here, I met my wife, and she asked me about my research, and I told her, and she said, that's really boring. And I told her about some other things. Well, here are some other things I'm thinking about studying, and one of them was volunteering and charitable giving. Partly because I'm an empirically oriented kind of person, and there's pretty good data on charitable giving in Canada. And so I thought that's a good place to ask research questions and try to test them. And she thought that was interesting too. So that's probably the main
win for Ross.
Yeah, exactly. I want to be able to have conversations about my research and not to feel like it's that boring, even though I recognize that as a researcher, what makes research valuable is you're asking an original question and answering it, which means that no one has really asked that question before. Right? Or no one thought it was worth the time to investigate as much as you want to. So, I know that my research is more interesting to me than it is to other people, but it's nice to have people that want to listen to it a little bit.
Well, and the great thing is that the questions that you're asking and the data and the information that is coming out of that research, while it might be boring in process for most of us to hear about, the results are actually very, very interesting and impactful. And I think that's the win.
Yeah.
Right?
Yeah. No, that's right. So my questions that I ask are my own curiosity, but you're right that I try to keep it somewhat related to answers that other people find valuable.
Well, now you've been on the Wealthy podcast, so that is very interesting.
Yeah,
so
no
one can,
it's great. I peeked right here.
Yeah.
Right now.
So, this is where I just start to go off script because I'm actually doing a little bit of, I've mentioned to you, I was in Mexico last week with my son, and he's very interested in geopolitics. And so, of course, all of the things that are happening right now in the Middle East, he was talking about, and I was like, I have no idea
Yeah.
really what's going on there. So I've been doing a little bit of a deep dive in my free time since I've been back, trying to figure out why things are happening. However, that's not my question.
Good.
But it relates to that because, we always talk about, nations and sort of like the big pinnacles, right? So the sort of like implications or choices that need to be made socially, politically, economically. So economics is a big component of how nations or countries organize themselves and their economic stance or leanings or decisions. Democracies, capitalism, all of that is essentially an economic platform.
That's right.
Correct?
Yeah, that's right.
Okay. I went to SFU too, and I did take like economics 101, but that's kind of where it stopped. But maybe to frame the conversation, I think it's worth actually defining what we're talking about. When I think we assume that we know what economics is, but what is economics defined, and how does it relate to, just in general, a country's sort of overall infrastructure?
Okay. Yeah, it's a good question. People have different definitions. So,
okay. So what is yours?
Yeah. So mine is economics is a study of how people make decisions about allocating scarce resources, right? So it's mainly about the study of trade-offs. Anytime people face a trade-off, I think that's an economics situation, right? So when I teach economics, I tend to say that there's three principles of economics. That the first one is that people optimize. So people are trying to do the best they can, right? So if you're facing a decision, you don't know what to do, you think to yourself, what's the best thing for me, right? So people try to do the best they can, and people recognize that other people are also trying to do the best they can. So a lot of the things that we do, the outcomes that affect us aren't decided entirely by us. So we'll try to do the best we can, but other people's decisions affect us too. So we respond, and in some sense, in economics, we believe there's equilibria. So there's an equilibrium there. There's a balance where, you decide what time you're going to show up to work, and your boss decides what time they're going to tell you to show up to work. And if you show up on time all the time, that's an equilibrium. If you're showing up late, your boss is like, hey, you're late for work.
Yeah.
Right. That's not an equilibrium.
Disparity.
There's a disparity. Exactly. That's not going to be an equilibrium. Right. An equilibrium is a balanced state, right? That's stable. And so that's first. So the first thing is people optimize. The second is that we do it in equilibrium. And the third part of economics is that it's an empirical discipline. So we make these statements that people optimize and they optimize in an equilibrium. And then we use that to help us predict what will happen in different scenarios. And we try to test our theories about what will happen in different scenarios. That's what makes economics different than, say, like other social sciences or other ways of trying to learn about the world. So it's not all about money and finances.
I think that's what people think.
But it's an important part. So like taking that disciplined approach of thinking, what are people going to do? Well, they're going to optimize. They're going to recognize other people are optimizing as well. And we should try to measure what happens in different scenarios. We should focus on measurement to try to learn about the world. That's what separates economics from other studies, but it's very important if we're trying to answer questions about money and banking and finance. And so, so that's the way I would define economics.
And the Wealthy podcast prides itself on having a very broad definition of health and wealth, and sort of the intersection of the two. We often talk about healthy economies, right? And so in the context of what you just said, that can be at the macro level, right? So healthy global economy, healthy national economy. But then you also have like personally, like your own sort of personal economic health. So these principles that you just spoke of kind of apply both at the micro level and the macro level?
Totally, yeah. So one of the studies I was involved with recently, we looked at how how households respond to somebody in the household getting sick. Right. So this was with a couple of researchers from Australia, another one from Canada, and one from the United States. And the five of us, we had some data in Australia that was a really great survey that followed people over time. It's called the Hilda survey.
Mm-hmm.
And it asked questions about every member of the household. And what we did was we looked at what happens to how people spend their time when someone in the household gets sick unexpectedly. And so we looked at the data where, again, the data is really great because it follows people every year over time. And we can see one spouse gets sick and the other one doesn't, and what happens to how they reallocate time. And economic theory predicts that people aren't gonna, if one person in the household gets sick, the other person is not going to just keep behaving as business as usual.
Right, because
right?
the equilibrium thing.
Exactly, right? There's going to be a rebalancing of things. So you see an adjustment in how much time people spend working, how much time people spend caregiving, how much time people spend on chores. The main thing we saw in terms of, we also looked at consumption, like how people spend their money. And of course, when someone gets sick in the household, you recognize that there's going to be this readjustment of time, right? That people are going to spend more time caring and maybe a little less time working, but also what people consumed was changed as well. So there was much more consumption of things that were, we'd say, complements to kind of being at home, but less consumption of alcohol and less money spent on vacations, right? So a little bit less in leisure in general. So at the micro level, right, at the individual level, we see that there is this idea of people doing the best they can, recognizing that there's trade-offs. When something affects somebody else, that also affects you. And we can test these things at the micro level, at the individual level, but also at the more global or national level. We see that countries make choices. We have countries that have leaders. Those leaders make choices. Those choices involve trade-offs. And it's not easy to make those kinds of choices. That's why these politicians get paid the big bucks.
Yeah.
Right? It's because challenging choices they have to make.
Interesting that you, that study, it makes me think of, like, I wonder what happens when the person that got sick gets better. And then what are the choices that are made differently after that? I have my own experience. I had cancer in 2019, and when I got better, and yes, there were trade-offs for sure during that time that I was kind of going through that. But then afterwards, my husband and I have taken a decidedly different approach to our own personal finances and economics and the decisions we make about where we spend our money and how we spend our time as a result of having that experience, right?
Yeah, totally.
We travel more, we spend more on things now rather than just sort of waiting for that day in the future that might or might not happen. It's very interesting. I feel like there's a whole other podcast in there.
Yeah, no, I think it's very interesting as well. I had a health situation during the period in which, shortly after we started studying this. So I was kind of still in the recovery phase. I had a car accident where I was riding my bicycle and I had a really bad concussion and broke a number of bones. And my spouse had to carry the load in a lot of ways during that.
Yeah.
And so that kind of influenced my focus on this particular topic as well. And I think that in the data, we only looked at people 3 years before someone got sick and 3 years afterwards. But you're right that there is a readjustment. It's not like economics doesn't suggest that you're always in the same equilibrium. Oftentimes there's multiple equilibria where you could end up. And so I know from my own experience that I don't do things exactly the same way I used to before, because when you have a health incident, you recognize how precious life is.
Yeah.
And some of the priorities you had beforehand, you think to yourself, are those really the priorities that I want in the future?
The goals change. Yeah. You also have an interest in public health, right? Yeah. Public health care, public health. And as you're talking about this too, I just think what an interesting plug-in to conversations around community health, public health, because when a community or society is healthy, they're able to make different trade-offs than if you're struggling to have clean water or nutritious food, those kinds of issues that thankfully in Canada, I mean, there are still areas that struggle with these challenges, but for the most part, we have we do have access to, clean drinking water, nutritious food that is economically viable. We can
Yeah.
buy it, but it's just very interesting how those things, the health of the community would have implications, because you would start to make different choices if there was scarcity, if there wasn't,
Yeah, for
am I
sure.
framing that the right
Yeah,
way?
no, it's a
Yeah.
great way of framing it. I mean, like, so thinking about it from the perspective of employers, if employer had a choice about trying to do the best that they can for their company,
Yeah.
would they choose a healthy worker or an unhealthy worker?
Mm-hmm. Mm-hmm.
Employers want healthier workers,
Mm-hmm.
right? And as a country, we have made ourselves a great place to attract foreign investment because we do focus on producing healthy workers and maintaining that health and viability.
Mm-hmm.
Part of the way we do it also is through immigration. And in fact, like the immigrants that we select into Canada tend to be higher education. And of course, immigrants are also tend to be healthier. You don't migrate when you're sick.
That's right.
Typically, you migrate when you're well. And so we have a relatively healthy population. At the same time, there are challenges and trade-offs still, though, in that.
Yes.
Because, as you said, there are some inequities, right? So there's some disparity in terms of how easy it is to live a healthy lifestyle. Particularly look at like remote northern communities. It can be more challenging to eat healthy.
Mm-hmm.
It can be more challenging to get regular exercise in some of those contexts. But
Mm-hmm.
overall, Canada is a relatively healthy country. But we still, of course, have room for improvement.
Which is a wonderful segue into our sort of the meat and potatoes of the conversation today, talking about how we keep Canada healthy, right? How economics plays into that. And I think it's worth also just sort of peeling the layers off the onion around how healthcare is funded in Canada. We always take this for granted. Working in philanthropy, we sort of just jump to this like, oh, we need to raise money to support, the advancements in healthcare that we want, this world-class healthcare. And then people are like, but yeah, we have universal healthcare in Canada. Shouldn't all of that be covered? And so we forget that there's this fundamental issue or question or system that provides the infrastructure for all of this. And that is this universal healthcare system that we really hold in such high regard. It's what makes Canada quite unique in the world. From an economist's perspective, what does that really mean? Like, what is universal healthcare? How does it work in Canada? And what are its benefits, limitations? What are the trade-offs?
Yeah,
I know it's a big question.
It's a very big question. It's also, I mean, so we have universal health care, right? I mean, and it is something that Canadians are proud of. Um, but I would say that I would caution us to place too much of our pride in the universality of the healthcare, because as you just said, that health we recognize is determined by lots of factors, not just through the administration of a public healthcare system,
Mm.
and there are inequities, right? So while it's universal in terms of if you go to the doctor, you can go and not have to pay. We have a universal payer
Mm-hmm.
for physician appointments and for surgeries and treatment in hospitals. That's what it is. Things like pharmaceuticals, we don't have a universal pharmaceutical plan,
Mm-hmm.
right? We essentially have universality of some form of an input into overall health for individuals, but we have inequality along those other dimensions. And that's one thing I think we have to recognize. We say universal healthcare, it's a part of healthcare that's universal, and it's important and it's great, but let's remember that some of these other margins, these things like pharmaceuticals, prescription drugs, and things like access to healthy lifestyle enhancing foods and activities, that's not all equal. So when we think about the financing of this, it's a provincial responsibility.
Right.
So the primary determinant of healthcare expenditures is going to be the ability of the province to provide those expenditures, the number one source of revenue for provinces is income tax. Okay, so that's the primary input. Now, the federal government also makes transfers to provinces, these equalization payments, to try to make sure that the level of public services that are provided is similar across provinces. That's important. That's part of our federation, that when Canada became a country, when these provinces joined together, we wanted to have free mobility of labor and capital. So money can flow across these provincial borders,
Yeah.
and people. And people wouldn't move so much if you had really better healthcare in one province relative to another.
Right.
So we wanted to have, well, of course, healthcare wasn't the main determinant at the time. Education was more of one of the public goods and services that people might have made different decisions about moving on the basis of. But we still, with healthcare, we don't want there to be big disparities across provinces, because that would hurt the internal labor market of the country.
Absolutely.
So we get these transfers to some provinces, these equalization and health, and there are healthcare transfers directly for health expenditures from the federal level, and that's financed largely through income taxes as well, the federal income tax.
Got it.
And so these provide for the infrastructure and the operations of our healthcare system that's delivered through the provincial governments. But as you know, with the Kelowna General Hospital Foundation, it's not everything is coming entirely from governments, right? So governments are paying the operating expenditures, and they're paying a large share of capital costs, but there's an opportunity for people to make investments through philanthropy to try to augment the capital that's available for hospitals and other healthcare facilities. And so, and again, while we say it's universal, I think, and it's single payer, there are disparities in that. So I know that people can receive treatment for fee when they travel out of province, for example, for elective surgeries and services. So I think that in some ways we put blinders on when we think about. We take so much pride in the universality, and we want to say, and I think oftentimes, unfortunately for Canadians, we look to the south, to our U.S. neighbors, and think about, all we need to think about is one example of someone not being able to receive the care they require because they can't afford it, for us to then say, oh, well, we don't have to worry about that. Same time, we have these long lineups sometimes and waits for certain services.
Trade-offs.
And it's a trade. Exactly. There's a trade-off. It's not like it's free, that we're going to have this, like, because we're Canadians, we somehow are gifted with the ability to deliver healthcare better than the Americans. It's like, no, we make a choice that we're going to have universality. We're going to accept longer wait times in exchange for allowing people to get access that otherwise couldn't afford it.
It's such an interesting set of trade-offs.
Yeah.
I love that you position it that way, and I think it's so true. And certainly healthcare when it's election time is like one of the top things that people are very interested in, what the politicians are saying their stance is on healthcare. Because and not to oversimplify, but I'm not an economist.
We oversimplify all the time, so go ahead.
Okay. But like at the end of the day, there isn't enough money anymore.
No, exactly right. So, I mean, if you look at where provincial finances are,
yes,
most provinces are currently operating at a deficit. Okay, and most provinces are projected to continue to be in deficit position for the next 20 years. Okay, the only province that as an exception is Quebec, and Quebec receives more federal transfers. And they also have higher taxes. Okay, the big problem with a lot of provinces in Canada is that we have all these obligations in terms of primarily health and education expenditures at the provincial level, but we have been reluctant to increase taxes. And so what we're seeing with the aging population is that there's an increase in the demand for healthcare services. And because we're trying to supply and meet that demand, more of our provincial expenditures are going towards healthcare and away from education. And at the same time, the increase in demand for healthcare is so high that we can't just shift away from education and cover those expenditures. We actually need more revenue. So right now what we're doing is we're borrowing as a way to try to meet that demand. And at some point in time, we're going to have to recognize that we do need more revenue if we would like to have the kind of service that we that we say we would like to have. I mean, universality breaks down when people don't get access to the appropriate care on time, when there are other ailments that they acquire, for example, if they were waiting a long time. So we do need to really think about it. Just by saying we have universality of healthcare is insufficient, right? It's not enough for us to just say that we have that. We actually want that care to be administered universally, right? We have a single payer, that's for sure, and we can be proud about single payer because that's true. But are people getting the same care universally? I mean, that's a really difficult thing to do anyway, to say that, you know, people have different mortalities, different life expectations about, you know, how long they think they will live, for example.
The
right?
sample size of one, right?
Yeah, exactly. Everyone's unique. Everyone's different. So people have different healthcare needs. And so it's not exactly uniform, but we can try to be as equal as we can be in administering it. But that means that sometimes we need to be very careful about the queue, right? We have to really mind that some people can stay in a queue longer than others. And I know that healthcare professionals try to manage those things and those trade-offs, and they're challenging. But what definitely makes it less challenging is if you have more resources available, and if we have the appropriate resources available. And I think that's kind of where I see the philanthropy coming in, is that while provinces have planners that are looking at where they should allocate capital resources, where should they have the next MRI machine, for example, local communities know quite a bit about what their needs are. And so individual giving through philanthropy is one way of expressing those needs in a way that is valuable. And also we can, in a way that is, I hate to use the word, but truthful, right? I mean, anyone can say, we need all these machines here, you know, like, hey, this is the Okanagan, this is Kelowna. You should put all of the equipment here. We need it all. Everyone can ask for everything. I mean, in economics, we call that cheap talk, right? I can always ask for everything. But if I put my money where my mouth is and I say, actually, we really need this, and myself and other concerned citizens, we've put some money forward and said, actually, we really do need this particular equipment here. And the fact that we put our money in, that makes it no longer cheap talk. That's a very strong signal that this community really needs it. They've done some work to raise the funds to demonstrate that. And our healthcare system does rely on that kind of input because that input is valuable. Everyone asking for everything all the time does not help a decision maker allocate scarce resources.
No, because then it's just equalizing everybody.
Exactly.
It's like you cancel everything out, right?
And that's inefficient. In a system where we already know we have potential for long queues, we really want, in a system, I'd say in particular, where we value equity so much, we know that there's a trade-off between equity and efficiency. So if we say equity is our primary value, then we know we're going to have some loss in terms of how efficient we're operating.
Yeah.
And so if we go too far in terms of equity, thoughtlessly, I would say, by saying it's going to be uniform equipment everywhere, every Canadian is going to be within 5 kilometers of every piece of, you know, healthcare equipment that is being funded by governments. That would be a terrible waste because some people have no need for that, right? But some people have great need. So we really do want to be careful in terms of how we allocate this. And that's where the voices of communities are really important.
Yeah, it's so, oh my gosh, there's like so many things in there. But just to build off of what you're talking about in terms of like the trade-off between equity and efficiency, we're starting to see, you know, when there's scarcity, which I don't even think you can argue that there isn't scarcity when it comes to healthcare funding in Canada. And I do think that there is a discrepancy between provinces as well. We're starting to definitely see that. When there is scarcity and let's say you have equity versus efficiency in terms of the trade-off, the other flip of the coin on the equity piece, I guess you could say, would be access. And now we're starting to see all of these, like, I call them like hacks or workarounds, right? Like they're privatized services that have somehow gotten around the system so that they can operate and charge for services. Like in some cases, you mentioned MRI, like you can actually jump the queue and pay for an MRI in BC. Yeah. Not in all like areas or regions, but in some of them for sure. And we're starting to see that with other services where you can pay for surgeries or you can
Yeah, look, I know exactly what I go to annually. I go to a skin cancer clinic to
Yeah.
get a full body scan because
Yeah.
in my family history, we're prone to skin cancer,
Yeah.
and so that I pay for that service.
Yeah.
Previously, I didn't pay for that service. I could get it through
And
the provincial authority,
and you
and
could still wait for
I
it.
could still wait for it. Exactly, I could still wait for it, but I've decided to pull myself out of that queue and then to pay for the service
Yeah.
because I can afford to. That's
Yeah.
I'm lucky,
Yeah.
right? And I recognize that not everyone can do that, and but that's something that I think in Canada. I mean, one of the things I talk to my students about sometimes are these repugnant markets. The fact that we think that some trading in some things is disgusting to us, right? And so, for example, like kidneys. You know, if I needed a kidney and I wanted to buy one from someone,
Yeah.
most of us would say, "Oh no, you can't buy organs. That's gross," right? So like it's a repugnant transaction.
Oh, interesting.
Now that makes it really difficult though, because some people really need kidneys.
Yeah.
You know, some people really need a
And
kidney.
like I have too.
Yeah, exactly. Some people
Need the money.
some people want to be able to spare that kidney for somebody else, or they might need the money. But the fact that we don't have a market, we don't allow people to trade, that means that there's going to be unmet demand. There's going to be some inefficiency, right? So when it comes to, but if we have the trades take place, even though they're repugnant with money, we actually can do better. This is what these economists, Al Roth is the economist who got a Nobel Prize a couple of years ago for his work on kidney exchange, not through markets, but through an algorithm where imagine you have a family member who needs a kidney, but you're not a match. Well, you can enter yourself into this database and they will find someone who's a match, who your kidney is a match for. And in the event that they find a match for you and a match for your loved one, they'll do the exchange where you give your kidney to somebody else and somebody else's loved one gives a kidney to your loved one.
Wow.
Right? To be able to facilitate that in a way that's okay with our idea that trading kidneys is repugnant, right? Like trading organs, we think, oh, we don't want that.
Yeah.
Now I bring that up.
Or like selling them, but trading them would be okay.
Trading them is okay. Exactly. So
yeah.
The thing with healthcare in Canada, we say we have a universal healthcare system and we have equality. So the idea of someone paying for it, sometimes people think that's gross. Like that's not fair.
Yeah.
It's not consistent with our values.
Right.
But where I come from as an economist.
Yeah, I was going to totally go there next.
I say, well, it's efficient. I think that, I think equity is very important, but there's an equity efficiency trade-off. And when I pull myself out of a queue, that frees up space for somebody else.
That may not have the resources to be able to go.
Exactly.
And this is the fundamental question, I think. At what point do we recognize that the universal health care model is not sustainable? I'm making a big assumption here that as an economist, you would agree with me that it's not sustainable.
I would say that, well, I guess I would say it differently. I would say that the universal healthcare system that we have has not been as universal as we think it is.
Yeah.
Okay. Historically, it hasn't been, and increasingly, it's not going to be. Okay. That's what I would say, is that it never was as universal as we thought it would be, because oftentimes people were pulling themselves out of the queue to travel to the United States for services.
And I think they're doing that more.
And they're doing it more, exactly. And so, and I, as an economist, I say, this is something that is we have to be very concerned for, because this is demand. Someone's willing to pay for something, and they're going to go outside of our economy to pay for it when they could be staying in our economy paying for it.
Okay.
And so if I were to travel to say the United States to get my skin cancer like full body scan, which I have to say it's very weird, right? Because I have to be completely naked, and they take these pictures. I have to pay them money. And I always thought the money would flow the other way, but this is just the way it is, right? So in any case, the point is,
maybe there's a market for that somewhere.
Yeah, I don't know. Maybe there is, right? But I haven't found it yet.
Your next research paper.
Well, exactly. Well, so what happens though is I go and I get this service. I pay for it. The person who receives that money, they pay income tax.
Yeah.
Okay. So it's not as if when I'm paying for the service here in Canada, and it's also helping the Canadian system, because the person who I'm paying, they pay income tax here, right? That's great. Now, if I went to the United States for this service, well, the federal government of the United States is collecting income tax on that transaction from the person who receives the income. And that's money falling out of our system and flowing into another. And so I think that in Canada, I would say we have to have a serious thought about what is it that we want equality of? or universality of when it comes to healthcare, and how are we going to finance that? And how are we going to allow for that to take place? And what are we gaining from prohibiting certain transactions? Is it really repugnant for somebody to pay for services that they require? I'm from Newfoundland. The former premier of Newfoundland had a health incident with his heart. He had a heart attack. He went to Florida for treatment while he was premier. It was, it was new, provincially recognized news. It was quite a spectacle. People were talking a lot about it. I think,
as in, like, he shouldn't have done that.
Some people were saying, he maybe he shouldn't have, or how does that look? I guess was many people were saying the optics of it. Yeah. But at the same time, I mean, my personal opinion was, everyone values their own health. You should value your own health very, very much, more than others. If you can't, it's like on the airplane, right? If you don't
put your own mask on first
before you help others, right? We should all have that perspective as Canadians. We should all have that perspective of, let's take care of ourselves. We can't take care of others if we don't.
Yeah.
So we should never be challenging someone so much when they make a choice that's for their own health, because that helps them contribute to society. But yet we do that. We say, oh no, we don't like the idea that someone is getting a little bit more health care. It's supposed to all be the same, but it's never been the same. People have different needs, right? Some people have the need to use the healthcare services more than others. And I think that that's perfectly fine. That's why we set up the way that we have, is to recognize that people do have different needs. But this prohibition is something that of people paying for services is something that we've inherited, that some people feel very strongly about. I think on the basis of ideology, not on the basis of evidence. I think that they speak to equity and universality, but I don't think they really appreciate where that there's evidence that we're having more equity or more universality. There's no talk about evidence. It's all about ideology. And that's where, as an economist, I say people optimize, and we want to understand how people operate in equilibrium, recognizing there's trade-offs and how people do things at the same time. We're making decisions to do the best we can, and so are others. But we have to be empirical about it as well to understand the world.
Mean that we
should
need
measure.
to look at it.
We need to measure, look at the data, and say, we look at the data. We have this universality people champion. Are health outcomes getting better? If they're getting better, if over time we're improving, then we say, yeah, it's a great success here in Canada, a great success story. We should keep doing exactly what we're doing and don't change. However, if we recognize that the data suggests that there are ways that we could be improving, we should recognize that and say, yeah, let's do the best we can, right? And I feel like it's hard to talk about because people don't want to people don't want to reduce how much they say equity is valuable. Right? No one wants to say,
is that why politicians seemingly just don't want to go there? Do you know what I mean? Like when we have a federal election or whatever, like I always think, why isn't, I don't want to call it like a dual system or whatever, but some sort of recognition, as you say, that there are other models that are working in other countries that have a combination of a universal plug-in and a private sector that is healthy, that is sustainable. But it's like nobody wants to actually go there. Politically, because it is political for the reasons that you said.
It's political, but it's also, I guess, so imagine we're going to start any new industry in Canada. Before I talk about healthcare, let's imagine the following. Canada has a balance of trade surplus. That is, we export more than we import. Okay, and our exchange rate relative to the U.S. is about like I don't know. You traveled recently, maybe you know better, but it's about one Canadian dollar buys about 70 cents US, I think, right? So it's around there, and that's been relatively stable for quite a while, right? Even though our amount of trade with the U.S. has gone up and down, right? But we generally still run a surplus. We export more than we import, but we import more investment from the U.S. We have more. So a country that has a net surplus of exports, if they have a stable exchange rate with other countries, they must have a net inflow of investments. Okay, as more people are investing in Canada from the U.S. As a result of this, to keep the exchange rate where it is.
Right.
So if we had any new industry start up in Canada, my claim is that it would likely be sponsored through investment from abroad,
Okay.
Okay, primarily from American investment would be a large source of the funds. And when we think about not just any industry, but a private healthcare industry, the idea that we're going to have American investments dictating how our healthcare is allocated in this private, exactly. I can see your
Yeah.
face, right?
Ugh.
People, yeah, the idea, the optic,
Repugnant.
exactly, the idea of it being shaped because we've for so long, I think erroneously, it's been a problem. We've made a mistake of for so long comparing ourselves and our healthcare system to the American healthcare system, and we've championed ourselves as saying, look at those people without access. We don't do that here. Everyone has access. So we've had this conversation about healthcare, always relative to what's happening in the U.S. It's put a negative sentiment
Mm-hmm.
towards the United States and healthcare in
Yeah.
Canada. And so I think that that's a problem.
So like
If
we
went-
just
if we-
automatically assume that the like an American investment, let's say, in the private infrastructure would be bad.
I think that people would probably take that.
Yeah.
And if we were to say open up a private market tomorrow, I imagine that. I mean, I imagine if we wanted to. I hope that there would be private American healthcare providing companies that would want to come into Canada to provide services. Why? Because they have the experience of doing it in the United States. They don't provide bad quality care in the United States. They provide very high quality
Yeah.
care.
Yeah.
Many people in the world travel to the United States to get healthcare services. Canadians, when the queue is too long, travel there for healthcare services.
Totally.
So the expertise and the talent is there. And if we opened up the doors, we would expect for that talent and expertise to flow into Canada. I think that would be a great thing for efficiency. However, I think politically, the optics
Yeah.
are not great. Okay. Now, I would say that health is too important
Yeah. That's
for
what
us
I
to
was
say.
gonna
For us to say, oh, these optics are not great. I mean, it's not repugnant to have American companies coming into Canada and delivering healthcare services.
making us
It's not
healthier.
like kidney trade, like kidney sales.
Yeah.
It's not like I'm buying a kidney, No, I'm just saying let these doctors and these experts and the capital and the equipment flow across the border to the north so that we can cut down the queues.
Yeah.
That's my view.
So it wouldn't be like you'd have to blow up the universal healthcare
No.
system. You would just create another
parallel system. And
Yeah.
that's so. And the reason why I says part of the when I had that cycling accident, I was in Australia. Okay, I took a leave of absence from UBC for 2 years, from 2018 to 2020. I took a job at the University of Melbourne, and while I was there, I was in a car accident, and I was treated in a public hospital. While I was there, I had the option of being treated in a private hospital. As a temporary migrant who was on a visa, I had to acquire health insurance that would give me the ability to go to a private hospital if I needed to, or a public hospital.
before you went there?
Before I went there, yeah.
Okay.
Before I went there, I had the insurance.
Yeah.
But they have a dual system there. So Australian citizens all have access to a public healthcare system. And those who wish to can have private insurance and access a private system. There are public and private hospitals. And part of how they make it work out is that physician pay is different at the public and private hospitals because it's treated differently, not just in terms of how much the employer pays, but also tax-wise. So if you're working at a public or not-for-profit hospital, your income is not taxed as much as if you were working at a for-profit hospital. And also with the equipment, part of the arrangement is that if you're operating a private hospital and you have equipment that's being underutilized, you have to rent it at cost, essentially, to the public system. So a lot of the investments in capital come from the private system, and then the public system rents those
Pays
out.
it.
Yeah.
But at least you're keeping those dollars
within
the
the country.
economy.
Exactly. It's all within Australia. Exactly.
Because I mean, okay, this is like hearsay media, right? But I've heard that there have been instances in British Columbia where we, for example, don't have the lab capacity. And so specimens or samples are being sent to the United States for pathology.
Okay.
Which would signal that investment, our tax investment, is now being spent in their economy, where it could be, if we had the lab capacity here, private labs or whatever, it could stay in Canada.
That's right. So I will say, I just will back up for a second. While I think, um, more investment staying in Canada is a good thing, I'm very pro trade. Okay,
Okay.
in the sense that
Yeah, like
so
let's go.
so yeah. So here's the
Yeah.
thing. I mean, so with things like specimens and pathology labs, we may put a priority on having those not cross international borders for privacy reasons or for other concerns. And those are legitimate and would trump the gains from trade, I'd say, right? But so we may want to have more of that investment here domestically in things like labs. But in general, I would say that trading with others is when there's a gain. It only takes place when there's a gain from trade.
Like the kidney.
Exactly.
Yeah.
There's some unmet demand that can be satisfied somewhere else,
Mm-hmm.
right? And so, I mean, I don't know. I think I tell my students, it's like the most beautiful thing in the world, right? Where somebody wants something and someone else wants something different, and they're able to make each other better off by engaging in trade, right?
Mm-hmm.
So I wouldn't say that that example is necessarily a negative thing.
Okay.
Other than that,
strictly that those.
I wouldn't. So I say, like, I guess I would think of it
There's
this
no
way.
trade back, maybe.
Well, there is there. If we are paying for that service,
Yeah.
That probably means that they are able to better provide it, or we don't, or it's too costly for us to provide
faster.
more, or
Yeah,
it's too for us to provide that equivalent service. It would require more of an investment here.
Yeah,
I guess,
okay.
or we would do it at a higher cost. But I guess that all begs the question of what is the overall objective?
Yeah.
Is there I don't think their objective with the healthcare system should be that we have as many dollars stay in the country as possible. I think the objective is that we try to have as high a treatment standard as possible for as many Canadians as possible. We try to get as equal access to high quality care as possible. And if that means that we have to do it in a way that's different than how we're currently doing it, that's an improvement that I think we should be willing to entertain. I think that would trump where are we getting the tax revenue from, right? The revenue problem, I mean, as an economist, I always think we should separate our problems as much as possible. Like the revenue problem is one that we can solve through different mechanisms than how we solve the problem of allocating healthcare services. Yeah.
So interesting. Wow.
Well,
okay. So we talked about and I have a million more questions on that vein of the conversation, but I'm going to actually switch now because we're running out of time. See, I told you this happens.
That's okay.
It's like crazy.
Well, it's been fun chatting so far.
I know,
I'm
right?
excited to see where we're going next.
Okay, well,
not the Middle East though, please.
No, I'm not going to go to the Middle East because I cannot speak intelligently about that at all. But what you're talking about is an opportunity to think differently about how we fund healthcare in Canada, right? Yeah. And that is the opportunity around sort of like a dual system.
That's right.
A public and a private that can work together. And you've provided an amazing example in Australia where it actually does really work well. And if the ultimate goal is the overall health and well-being of individuals and communities, then those kinds of opportunities are ones that ideally we're looking at. You know, like we're not just putting the blinders on and saying we revere universal healthcare so much, and that is the pinnacle of what good healthcare looks like. Recognizing that now we're in this scarcity situation, that there's just more demand than the supply, and even more revenue could probably even deal with. Right?
Yeah, that's right.
Right.
Yeah, I'll just say, like, what I want us to recognize is that universality is a great value. We can't manage it entirely. We never have been able to. People have always been able to elect out of the queue.
Yeah.
And into some other market.
Right.
We just have made it difficult for them to do that. We've made it costly for people to come out of that queue and go and find healthcare services elsewhere. I'm saying that we should consider not making those so costly for people to leave that universal public healthcare queue and get access. We should maybe encourage that access to come here to Canadians that need that kind of service.
Right. Yeah, and I think then it's worth talking about. You mentioned, and hey, listen, I have a job. here because there is another way. It's not going to be the fixer of all problems, but there in the absence of a bigger solution, system-oriented solution, the other workaround that has been very successful, particularly here in our community, has been philanthropy.
Yeah.
Yeah. And I loved what you said about local communities have the ability and the intelligence to determine what they need, right? And
Yeah.
to be able to inform, local healthcare administrators with regards to what they need.
Yeah.
And how do you see, the KGH Foundation, we've sort of gone over, had this fundamental shift in how we see our role. Before sort of the current leadership was in place, there was always a relationship with the health authority whereby the province would say, here's our priorities, here you go, local health authorities, these are the priorities, distribute these very little amount of funds as best as you can. And I will say that they do the best that they can with the limited amount of funds that they have. But sometimes those priorities don't necessarily align with the hyper locality of what the communities need.
Yeah.
Right?
That's right.
So we've sort of taken on this little bit of a fundamental vision shift in saying that is important, that we do work with the province, we work with the health authority as they're our primary partners. And what do the physicians say? What does the community say? What do patients say? What do they need? And by extension, that conversation has now shifted, and Ali can articulate this much better than I can, to if we commit to funding part of this, can you, province, meet us there as well? Right? So that you don't have to go all in. Robotic assisted surgery was one of those commitments that we were able to accelerate the acquisition of that technology here at KGH because the foundation said, okay, we will put $5 million towards this acquisition.
Yeah.
That makes it less of a a big pill to swallow for the province, right?
Yeah.
Okay, so I do have an opening here for you. I want you to tell me, because this is an area of interest and specialty for you.
Yeah, that's right.
Why is philanthropy so valuable in today when it comes to the provision of healthcare in our communities?
Yeah, so that's a great question. So, as someone who studies charitable giving and philanthropy, I recognize that in the literature, and I think it's reflective of what's going on in reality, though these things are sometimes not always the same.
Yeah.
People describe people's desire to give donations to an organization on two kind of bases. One is that it's instrumental, that if I give money to this organization, it's going to do something with that, right? So I care about the outcome that comes from that gift. That's one motivation that people have. And in some cases, that's a driver of donations. But another part is it's the relationship. It's a relational. So someone's a member of a community and they support an organization because they want that organization to thrive because the organization is part of their community. And they recognize that as part of a community, I care about the overall well-being of these organizations. And I think with something like the Kelowna General Hospital Foundation, there's both of those things at work here, right? So some people are motivated to give because they care about the particular outcome that's going to happen. And with healthcare giving, you can see that outcome, as you just described with the robotics surgery. Yeah. So that's a particular outcome, and people can say, yeah, I helped to finance that outcome. And what's the next outcome we're going to affect through our giving? But then there's also just the handing over of the resources to an organization that you know is important in the community, that you trust to steward those resources in the best interests of the community, and to do that in a way that's part of the relationship that you have with the community. I think that's another part of this. So I think those two things are motivators that are going on with philanthropy for all organizations, right. but the Hospital Foundation in particular has those two kinds of donors, I would believe. And I think part of what's important in terms of how that fits into the healthcare system with things like hospital foundations is that there's, as I said before, there's that need expression of local knowledge, knowing a little bit more about local needs and being able to express that. That's a part of it. And that's instrumental, I would say, that can help affect particular outcomes.
Mm-hmm.
But there's also like the overall, as we discussed, the overwhelming feeling that the system is not working as well as it possibly could, that in some ways we see that outcomes are not as great as we would like to see them through the healthcare system, and people feeling like, what can I do to help?
Yeah.
What can I do about this? I could write a letter to my member of the legislature. I could write a letter to the member of parliament. I can talk to people about it, but those things may not give the same agency that a donation would give. And giving donations to an organization that you trust to steward the resources in a responsible way and to allocate them in the best way possible to help the community, that's one way people can feel agency, that people can feel connected to the community and I'm being a part of the solution, right? Being a part of the solution is what I think people want to see. Everyone wants a solution, but it's hard, as you said, politically, it's hard to encourage those trade-offs to take place in a way that we think is going to make a change. But by giving, we can make a change. We can make a difference. It can't be always right here and now. It takes a long time to raise the funds necessary to purchase capital equipment, right? So you give $1 today, it's not going to mean that dollar spent today. That's part of why the foundation is valuable. It can retain those earnings and not pay taxes on those earnings and make it grow so we can actually afford the capital equipment for the community.
Oh my goodness. I just feel like I want to clip that whole thing that you just said and we'll use it as a short promo piece to all of our potential new donors.
Oh, wow. I should have done it with jazz hands.
You didn't have to. It was so well articulated and, you know, coming from a third party and someone like yourself who has a broader view of economics and how this whole system works. Do you know what our tagline is at the KGH Foundation?
I don't. No.
Okay.
I'd like to hear it though.
Yeah, but you're not going to be surprised when I tell you it's giving changes everything.
Okay.
So, and we have had that, we adopted that tagline about, I don't know, probably 8 years ago. It's really hard because I'm tempted as a marketer to change it, you know?
Oh, yeah.
Also, I have my own tagline, which is Shauna changes everything. But the one...
So you don't recognize they're almost the same thing.
Totally. But the reason that it works so well is because of I don't even want to say duality because there's more to it than that. What philanthropy enables is, yes, you give $1 and then because we are truly and you know, reputationally accredited to steward that dollar for the maximum impact. That is one of our pillars here is maximize impact, right? That dollar will change something.
Yeah.
Right. So we can keep that promise. Giving changes everything. That's will change something.
I would say that in the immediacy, though, what giving does is it changes the person who gives.
Oh, see?
Right? Because
that's the story.
Because it takes trust, right? It's if you think about belief, exactly. So you can believe in the hopelessness of what's going on with the healthcare system, or you can decide you're going to trust that there's an organization that you give your money to this organization, and when you make a gift, you lose control. Somebody else has control. That's the beauty of the gift, is that you give it. And when you give it, you're saying, I trust this organization to be responsible, to be the steward. And that's a valuable thing. Trusting other people is something that people feel good about. It makes you feel good to trust others. And so the more we have that in the community, the better.
Yeah. And it's interesting. We talk to donors a lot about, you know, why they give. And I think, you know, sometimes it starts with a very practical tax reason. And, you know, we didn't even get into that, but there are very practical tax reasons to engage in charitable giving. Totally. But then they're like, once you start, you can't stop because it changes you as a person. When you first, as you mentioned, feel like you have some agency in these bigger challenges that we're facing, it would be easy to just sort of sit back and say it's hopeless. Like, what can I do as one person? Like, all I can do is like bitch on the internet,
Mm-hmm.
which some people do, which
Yeah.
infuriates me. Just saying, I don't
Yeah.
want to be judgy, but like,
Yeah.
put that energy into something constructive or active, right?
Yeah.
So when you give, you're taking action
That's right.
and you're making a choice to have agency in the outcomes,
Yeah.
right?
That's right. Yeah.
So if so there's that. But then it's like you said, what we've heard over and over again from our donors is that they feel part of a community. And if there's one thing that I know we are also struggling with as a society, let's say, it's this sense of disconnection from one another.
Mm-hmm.
And so the action of giving to something that you may not necessarily benefit from yourself in the immediate future, but will benefit your neighbors or the lady that works at the grocery store or the coffee shop or whatever, there's something that makes you feel really good
Yeah.
about that and very connected
Yeah.
to your community. Um,
Yeah, that's right, and it makes you healthier too. That's the other thing. The
and
study and
it
the
makes you
research shows
healthy.
that also people who give, whether it's time or money, that actually does improve your health. You feel better as a result.
Yeah.
And so it's part of holistic health is to say, in the face of challenges, what can I do? And the answer, if you find the answer is nothing, that's very unfortunate, right?
Totally.
But if you find that the answer is something, then doing what you can be very helpful for addressing the problem and for yourself. It's helps you to flourish.
I completely agree. And even if you look at one of the ways I learned this most powerfully was when I became a patient myself. And for me, the cancer experience was really illuminating because there was a lot about that I had no control over.
Mm-hmm.
Right. And in the beginning you feel like that's all you're doing is like you're just waiting for the next call, the doctor to say this or that. And there's no agency in that at
Mm-hmm.
all.
Yeah.
I imagine you felt kind of the same way after your car accident.
Yeah.
But then if you're a certain kind of person that literally, like for me, that's not gonna work for me. Like I can't sleep at night if I feel like I can't have some impact on the overall outcome.
Yeah.
Then you start to find these ways where you can start to heal yourself.
Yeah, that's right. It takes. Yeah,
I'm getting all meta here
no,
on
no,
it,
but I
but
agree with you. Right. So, like finding the opportunities to take the positive steps that you can do something about the situation.
Yeah.
Right. That's it's hard to find those things. I know after I had that accident, the hardest part for me as an academic was that I had aphasia. I don't know if you know what that is, but it's where you can't say the words that you want to say. So
Yeah.
I had a very hard time speaking, and as somebody who and I had a very hard time with my memory. I had very bad short-term memory. So like this conversation wouldn't have got past the first couple questions if that happened immediately. If we were having this right after that accident, because I couldn't keep track of what was going on, and so that was very hard for me. And it took the help of my wife to kind of say, you should try to do things to make yourself feel better.
Yeah.
Right. And I was very, I guess, I got very down, after the accident because I had that loss of control and not being able to remember things in particular made socializing very difficult. But my wife really pushed me to try to find things that you can do that will make you happy. And encouraging me to just put myself out there,
right,
and get involved in things
and get involved in your own recovery.
Yeah, exactly. And it did, and so there's a number of things that I did differently afterwards, mainly being much more social than I was comfortable with, and engaging with people in conversations that was challenging, but it helped.
Yeah.
Right. And that's the thing. I think getting involved is the first step. Right. Mm-hmm. Taking that first step towards joining a new activity or being part of a group. It can be hard, but it usually is pretty fulfilling.
Well, we often talk about, the KGH Foundation family. And I say that even though I know it sounds kind of cheesy, but that is how we have structured the relationships in our organization. Is it just feels like that, and there's always room for more. So anybody out there that's listening that, came to this conversation perhaps seeking more understanding about why the health system is the way it is in Canada, maybe even it's easy. It's not hard to feel jaded,
Mm-hmm.
right? But I just want to underscore that there is an option that you have right now, even though we don't have yet this opportunity, this bigger opportunity for system change in Canada that we talked about earlier.
Mm-hmm.
There's a real beautiful opportunity right here in the local community to have an impact on the healthcare that's being provided right here in our community, as really informed by you,
Mm-hmm.
by the community themselves. That door is always open,
Mm-hmm.
and that there are so many, I know we talked about, this is a conversation about economics and trade-offs, but I don't see a downside.
No, I guess also I guess I would say from the economic perspective, even the little gifts, the small gifts, when they're given to a
100%.
foundation, there's the power of compound interest, right?
Mm-hmm.
So the fact that this money is going to grow in the hands of the foundation means that even small gifts become larger impacts.
That's right.
And I think that's something that people sometimes don't see, because you think, oh, it's only a small amount of money. How is that going to make a difference?
That's
But
right.
these small amounts of money for many people growing over the years through being invested wisely has massive impact.
Absolutely. This has been such a fun conversation. Truly, not boring at all. Like, I could keep going. They keep telling me wrap, and I'm like, I don't want to. Okay, so I'm going to, but then I'm going to leave the door open to have you back, because like I have all these questions.
Sure.
And I told you at the beginning, I kind of usually just go with the flow. Probably didn't even get to any of them, or probably got to all of them in some roundabout way.
Yeah.
But one of the questions that we always ask last here, because now we're friends, is, so this is the Wealthy Podcast. And by wealthy, we have this broad definition of health, that health is wealth, and that health is comprised of all of the things, right? It's comprised of, your physical health, your mental health, emotional health, spiritual health, financial health, community health, all of the things. Therefore, in what areas of your life, Ross, do you feel that you are wealthy?
Oh, wow.
I know I didn't put that on the
Yeah,
list.
good question. I would say in terms of my family, I'm married. I've been married for 15 years, and I have 2 children. And every day we're a handful to each other, each of us individually, but it's great being part of family. My family, my extended family, like my in-laws are here in Kelowna. My father lives here in Kelowna, and my stepmother. So I have lots of family around, and that I feel just so wealthy and healthy because of that. Yeah. So it's those relationships, I think, the most important. Yeah.
Well, thank you so much for joining me for this conversation. I really appreciate the honesty and authenticity you bring to what is kind of a complicated conversation. The raves coming from our forum did you justice, and
thanks.
that experience has been replicated here with me. It's been an absolute pleasure. So thank you for joining me.
It was a lot of fun. I'd be happy to come back. It was great. Thanks.
Well, okay, then we'll make it happen.
Okay.
Thank you.